Dallas Nephrology Associates says diabetes and kidney disease are closely connected, and with November being National Diabetes Month, it's a great time to increase awareness about that vital link. And today, Dr. Hector Santiago joins me to share how diabetes and kidney disease are related and share some easy tips to help you maintain those healthy kidneys. Good morning to you.
Good morning.
So glad to have you here. So I'm starting out with the easiest question. Tell me, break it down for us. What is diabetes?
So diabetes is a condition in which the body cannot produce or use well the insulin that it's supposed to. Usually insulin is a hormone that basically breaks down the sugar in the food to turn it into energy for the body. So when the whole process is not working, what you get is a buildup of sugar in the body that goes all throughout all the organs and causes some damage.
Wow.
So there's two types of diabetes. Type 1 diabetes, which could be most commonly found in children or teenagers. That happens when the body's not able to make enough insulin for the body. And type 2 diabetes, most commonly in adults, that happens when the body is not able to use the insulin it produces.
Okay, interesting. You know, when I read the question, I was like, oh, okay, what is diabetes? I was like, of course everybody knows what diabetes is. But now that you've explained it, I didn't know the difference between 1 and 2. So I'm so glad that we ended up asking. Now, how do you know if you have diabetes? Is there certain symptoms before actually being diagnosed?
Of course, there are symptoms that you can keep an eye out for, but they're subtle. Symptoms like increased fatigue, increased hunger, sometimes increased thirst. There are other symptoms like itchy, dry skin, frequent urination, or maybe even blurry vision can be symptoms that you can present with diabetes.
Okay.
Of course, the best way to know if you have diabetes would be to get some testing done by your primary doctor. That looks like getting either a fasting blood glucose test or maybe an A1C test, which really average out the blood sugar levels you have for the previous 3 months. And with the A1C, a 6.5% or more means that you're in diabetes range.
Okay.
So that's what we should really target when we're looking for diabetes.
Got it, got it. Okay, so we were talking about the link between diabetes and kidney disease. Tell me, what is the connection? Why are they so closely linked?
They are very closely linked. So when you have high amounts of sugar in your body, it goes everywhere, and it goes specifically to the tiny blood vessels in your kidney. You can think of those tiny blood vessels as maybe filters in your kidney. So if you can imagine the kidney is a big unit of a million little filters, you can see how that excess sugar can go into your kidneys and clog up those filters, maybe even damaging them, and that's what leads to kidney disease. When that develops, you basically cannot filter out all those toxins, that waste products, and excrete it through the urine with the excess fluids. So diabetes will be the most common cause of kidney disease in the U.S.
Yes, indeed. Okay, before we go, I want to make sure that everyone at home gets solutions. So tell me better ways to take care of ourselves before we reach that point, or if we have reached that point and we do have diabetes or kidney disease, how we can take care of our bodies going forward.
Right. So we got to make sure to get the testing done at the right time. Of course, if you know you have diabetes, go to your primary doctor, talk about getting tests done for kidney disease. You'll get to get a simple blood draw that can monitor for something called creatinine that will let you know how your kidney function is doing. You can also get a simple urine test, which tests for protein leak, and that can detect early signs of kidney disease. So really managing diabetes is the best way that you can get control of your kidney disease.
Exactly.
Some simple ways to really get to know that you can change your lifestyle to get in charge or better take care of the diabetes and the kidney disease will be adequate hydration, maintaining an active lifestyle.
Very good.
Of course, we can also avoid excessive salt, excessive sugar, maybe even excessive pain medications like ibuprofen.
Very good. All right. Well, Dr. Santiago, thank you so much for coming on, sharing all this knowledge. I mean, I've even learned something this morning. Hopefully you have as well. You can scan that QR code. It's on your screen right now, or you can call 214-358-2300 or 877-654-3639, or you can go to dneph.com for more information. Thank you so much,
Thank
Doctor.
you so much.